For millions of people, chronic pain isn't just an annoyance, it's a daily, life-altering struggle. But what if I told you that one of the most powerful new tools to fight it isn't a pill, but a completely different reality? Yeah, you heard that right. Today we're diving into the wild world of virtual reality and how it's actually becoming a serious weapon in the fight against pain.
I know. It sounds like something straight out of a sci-fi movie, right? Can putting on a headset and jumping into a virtual world really change how you feel pain in the real world? Well, that's the big question we're tackling today, and trust me, the answers science is giving us are absolutely fascinating.
All right, so here's the plan. First, we'll get into the nitty-gritty of how your brain even deals with pain. Then we'll talk about Snow World, VR's incredible trial by fire. After that, we'll see how it became an actual prescription, check out what you can find on your own headset, and wrap up with the super important stuff, the limits and risks. Okay, so let's get right to it. How in the world can this actually work? Well, the answer is all in our brains. Thanks to a really cool quirk of neuroscience. See, it turns out that pain isn't just a simple signal from, say, your back to your brain. It's an experience that your brain is actively building. And the key part? It can be convinced to, well, unbuild it.
The big idea here is called the gate control theory. Now, the easiest way to think about it is this. Imagine your brain's attention is like a single, powerful spotlight. When you're in pain, that spotlight is locked right onto the source of the hurt. But VR is just so much. The sights, the sounds, the feeling of being somewhere else, it's so immersive that it basically hijacks that spotlight and points it somewhere new. And since your brain can only focus on so much at once, if it's busy exploring a virtual world, it has way fewer resources left to process those pain signals. It's almost like it just closes the gate on that.
So this whole theory got put to the ultimate test in, well, one of the most painful situations you can possibly imagine, treating patients with severe burns. This is where we get the incredible story of Snow World. Yeah, this quote really tells you everything you need to know about the challenge researchers at the University of Washington were up against. I mean, think about it. Even with the strongest pain meds available, the simple, necessary act of cleaning wounds was just excruciating for these patients. They were desperate for something, anything else to help. And their solution? It was called Snow World. It was this cool, icy virtual world where patients could fly through a canyon and just throw snowballs at penguins and snowmen. It sounds simple, but the results were just mind-blowing. When patients were in Snow World while getting their wounds treated, their pain scores dropped like a rock. We're talking a huge, measurable difference that gave us the first solid proof that VR could actually act like a painkiller.
So, Snow World was a game changer. It proved that VR could work for that sharp, intense, short-term pain. But what about the bigger monster? What about chronic pain? The kind that just sticks around for months or even years? That was the next big hurdle, and it pushed VR to evolve from just being a cool distraction into a legitimate, full-blown medical therapy.
And that evolution led to a truly landmark moment. A company called Applied VR created a program called RelieveRx, and it became the very first VR therapy to get FDA authorization as a prescription device specifically for chronic lower back pain. This was huge. All of a sudden, VR wasn't just some cool research project anymore. It was a real, officially recognized medical treatment.
Okay, so what does this actually look like for a patient? It's pretty straightforward. Your doctor prescribes it, and a headset with the program already loaded on it gets mailed right to your house. Then you do this 8-week program. We're talking 56 daily sessions, but they're short, like 6 or 7 minutes each. And here's the key. It's not just about distraction. The program actually teaches you skills based on cognitive behavioral therapy, so you learn how to manage your pain for the long haul. When you're done, you just pop the headset back in the mail.
But you might be wondering, is this really any better than just, watching a relaxing nature video? Well, the clinical trial for RelieveRx answered that with a big, loud yes. They actually tested it against what they called a sham VR, which was basically just a 2D nature video playing in a headset. And the results couldn't have been clear. The real immersive 3D program, it led to major drops in pain and big improvements in physical function and even sleep. The 2D video? Pretty much no change. It proved that the interactive part of the therapy was the secret sauce.
And get this is what's really incredible. The effects last. Follow-up studies checked in on patients, and they found that the benefits, the less pain, the better quality of life, they were still there up to 2 years after they finished the 8-week program. 24 months. That's how we know this isn't just a temporary fix. It's actually helping to retrain the brain for real, lasting relief.
Okay, so at this point, if you have a headset at home, you're probably thinking, hey, can I just download an app for this? And that is a fantastic question. It brings us to a really, really important difference we need to talk about. The difference between a medical device and a general wellness app.
And this distinction is absolutely critical. So on one side, you have something like RelievRx. It's an FDA-authorized medical device. A doctor has to prescribe it to treat a specific medical condition, and it's backed by serious clinical trials. Then on the other side, you have wellness apps. These are not medical devices. They're for things like relaxation and distraction, and anyone can download them. And look, they can be great for helping you unwind, but let's be super clear, they are not a replacement for actual clinical therapy.
So what are we talking about when we say wellness apps? Well, it's the stuff you'd probably expect to find on your headset. You know, guided meditations where you're sitting in a beautiful virtual forest, or some simple fun games that are just meant to take your mind off things, maybe some gentle stretching exercises. And they can totally be a great part of a healthy routine. But it's so important to see them for what they are, tools for general wellness, not treatment for a medical diagnosis.
All right, and of course, anytime we talk about health and medicine, we absolutely have to talk about safety. This stuff isn't a magic bullet, and it's so important that we're clear about the limits, the potential risks, and when you really need to talk to a professional.
So let's just ask it straight up. Is VR pain management for everybody? The short answer? No, it's not. There are some really important things you need to be aware of before even considering it.
So think of this as your essential safety checklist. Number 1, and this is non-negotiable, always talk to your doctor or another healthcare professional first before you try anything new for pain. Seriously. Number 2, remember that VR is an adjunctive therapy. That's a fancy way of saying it's meant to be used with your regular medical care, not to replace it. Also, be aware of possible side effects like motion sickness. And finally, this is not recommended for anyone with a history of epilepsy or seizure disorders.
So when you step back and look at it, we've watched VR go from a simple distraction technique to this incredibly sophisticated tool that can literally help retrain the brain's entire relationship with pain. That is a massive paradigm shift. We're moving away from just covering up symptoms and toward actively changing our own perception. And that just leaves us with this one huge question. If we can use technology to reshape something as raw and fundamental as pain, what's next? What other supposedly unbreakable parts of our own experience are we about to unlock?